Today we are using PRP to do a butt lift. So we are very excited that we can do this. So there are few different ways that you can lift butts. One is you can use some Sculptra. Two is you can hyperdilute some radius. And three is we can put some PRP in there, which means platelet-rich plasma. And that's what we're doing today. So I've already drawn my patient's blood, I've spun it down, and I've got her platelets all in this handy-dandy syringe. And then I've got her platelet pore plasma in these syringes. So we're going to use all of this in her bottom part of her back to lift her butt, and then to the top part of her glutes. So we've already numbed the area. I've circled the area that I'm going to inject, and it is going to take about 3 to 4 months to see results. So we're going to just be patient with this, because the platelets are going to signal to her stem cells, to migrate over to where they are, and then they're going to become brand new tissue. Sort of like doing the breast lift, but we're doing this in the buttocks. So I'm going to go ahead and start. Are you ready?
Mm-hmm.
All right, 1, 2, 3, la la la. All right, here we go. We're just kind of disperse the. Bring your. Well, I don't think so. Never mind. So we're just going to kind of do some thin threads here. Okay. Now I'm going to move over and go again. 1, 2, 3. Hi, hi, hi. Here we are. Going here. You doing all right?
Mm-hmm. Yep.
Okay. Mm-hmm. And cover this whole area. There we go. And really, this is just your own blood, so there's really no risks for you, because we're using your own. All right, here we go. We're going to go here. We're just going to kind of feather it out here. Okay, and one more spot back here. La la la. There we go. Is it burning or anything like that? Or?
Mm-mm.
Good.
Nope.
All right, good. And beautiful. All right, you doing okay?
Yep.
Okay. So I'm going to just use now, we've got a whole bunch of platelet pore plasma that we are also going to use, because if we have it, we might as well use it. So I'm going to just go ahead and I'll layer it on top. 1, 2, 3, la la la. All right. So you're going to feel kind of full, your bottom area, probably today and tomorrow, and then it'll get better. It shouldn't really hurt, and you're not going to hurt it by sitting, so don't worry about any of that. Okay, one more down here. Oosh. There we go. And you doing all right still?
Yep.
Okay. Almost done with this half. Okay. Got 2 more pokes over here. You can do it? You can do it, right?
Of course.
Of course you can. Yes, because you're strong like bull. All right. Okay. I'm going to go over here now. Ready? 1, 2, 3. And, there could be some bruising just from the fact we're using needles here, but people generally just have some tenderness. I would say probably be a good idea to wear some yoga pants or something that's going to keep your butt cheeks close to your body. And you could always, if you wanted even more of a lift, you can always add PDO threads back here. We're going to see what we get out of our platelets. All right, almost done with this guy. more poke on the other side. You doing okay?
Yep.
Okay. And I mean, cream help some?
Yep.
Awesome answer. Okay, that's a good response. Okay, one more poke down here. La 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 la. All right. I think when we have our goal in mind, we get there. We do whatever we have to do to get there, right? Good deal. So we're going to go to the other side now. Now we are moving over to our other side, but you need to come in close and take a peek at what a difference already we see with all the PRP on this side, and this is the side we're going to. I mean, it looked like this before we did all of that. So hopefully that comes across in the video, but now we've got another cheek to go. So we are going to go ahead and inject this side. So I'm going to start right over here, okay? 1, 2, 3, hi, hi, hi. And we're gonna start the process again, but you know, it doesn't take that long. Let's start. I want to get the top first. 1, 2, 3. There we go. And yeah. And we're gonna turn it around. See if I can turn it around without coming out. Yeah. And beautiful. So now we're going to grab some platelet pore plasma and we're going to go on top of it. Okay, let's see. We probably will have a couple more pokes than that. 1, 2, 3. Hi, hi. Alrighty, here we go. This is the platelet pore plasma. So even though there's not as many platelets in this, there's still growth factors and cytokines and things that are gonna still help. And I figure if we've got it, you might as well use it. That's my attitude. So I like to use all the platelet pore plasma with the breast lift as well. Okay. We got one more. Got one more syringe, okay? Such a trooper. I'll do the top part. Let's see. I'll go next to here. Ooh la la. Alright. I like filling this part of the lower back, upper glutes, because this is the part that's going to really pull up. The other help to pull up the buttocks. The other thing that you could do to help this work even more, besides PDO threads, would be to do scarlet. Scarlet tightens and lifts. It's microneedling with radio frequency, so that's another way to help this work even better. Okay. I think I can get the rest all in this one spot. Here we go. I'm almost done here. You're doing so good. Almost there. It's just really easy. You don't have to go too deep with it. But you could just see how easily we can infiltrate that area. Right around like that. And we are done. So if you are interested in learning about the butt lift, come and see us at RejuvenationMD.